Go.
Okay. So what I'm going to demonstrate now is just taking a patient out of a cage and putting them back in.
Yeah, let me pick you up.
So you just want to make sure to support the whole animal and be gentle. So that's taking the animal out of the cage and just putting them back in safely. Okay, that's it. Okay, so what I'm going to demonstrate today is drawing blood from a cephalic vein on a cat. I'm doing this on my cat at home because in the emergency department, ICU, we don't like to draw from cat cephalic veins because we have to have that access for a catheter. So I'm going to demonstrate on my cat here. So what I have is I have my tuberculin syringe. I've got my alcohol-soaked cotton swab. I have my helper here restraining. She's going to hold the arm out. She's occluding the vein right here at the elbow and rolling the vein outwards for me. So I'm going to wet the arm. And I'm going to take my tuberculin syringe here. I'm going to go in, bevel up. I'm drawing just enough blood. I'm drawing about 0.1 milliliters. And so I've got my blood here, and I'm going to wrap it with a Band-Aid. Okay, so I've got my Band-Aid. I'm going to wrap it around his arm to help the site clot, and I will remove the bandage in about 30 minutes. And that's how you draw blood from a cephalic vein on a cat. Okay, so what I'm going to discuss now is a non-rebreathing system. Here we use the Baines non-rebreathing system. So how this works is it doesn't allow the patient to rebreathe expired gases. So how it's configured is you've got the reservoir bag down here, and it is connected to the patient at the ET tube. You have two lines. One line is connected to the fresh gas outlet port, so connected to the vaporizer. And then the other line is connected to the scavenging system. So what happens is the oxygen flows through the machine, it goes through the vaporizer, goes down this tubing, and the patient will breathe in the fresh gas with the anesthetic in it. You will see the reservoir bag open and close. When the patient expires, it goes from the reservoir bag through this tubing, which is then connected to the scavenging unit and leaves the hospital. So normally this system is used on animals under 10 pounds. So when you're using the non-rebreathing system, you need to turn on the oxygen about 2 to 3 times the flow rate that you would with a rebreathing system because the animal does not take as big of breaths, so we need a stronger push of oxygen through the system. So the difference in the Baines system, between the Baines system and the rebreathing system, is that the exhaled gas does not go through the carbon dioxide canister. It bypasses that and goes directly into the scavenging system. Okay, so what I'm going to discuss today is using a mask induction chamber. So what you want to do is you want to make sure that the rubber seal fits the animal appropriately. This is larger than I would need for this little animal. But what you'd want to do is stick the muzzle through the rubber gasket. You would want to make sure that the nostrils do not touch the end of this, but you want to make sure the entire muzzle is enclosed here. And then it is hooked up to your rebreathing system. So it's getting fresh gas and isoflurane. So the issue with the mask induction is it does take longer to induce patients. So it's not very good for patients with decreased respiratory function, maybe unfasted animals, or patients at risk for vomiting or regurgitation due to induction. So the other issues with mask induction are it can allow for significant waste gas exposed to the operating personnel. It can be difficult for patients that are resisting and being pretty difficult to restrain. So you would really need to be skillful at restraining and make sure that you are not preventing them from breathing. You would need to monitor things like the mucous membrane color, capillary refill time. You would be checking palpebral reflexes, and that is how you induce anesthesia with a mask. So what I'm going to discuss now is using an induction chamber for anesthesia. So what this is a clear plastic cage, kind of like an aquarium. It's got this lid on it that has a very tight seal. You clamp it down and lock it in. You want your patient to be either lateral or sternal recumbency. You just want to make sure that their head is extended so there's not any issues blocking the ability to breathe. So how this works is you have two ports. One is for the fresh gas inlet with the anesthetic agent, and the other one is into the scavenging system. Now, this method allows anesthetic induction to very small animals, a lot of times like pocket pets, or animals that are very aggressive and super stressed out. This kind of gives them the ability to relax without being handled. Now, one aspect of using the induction chamber is you are not able to monitor all of the necessary signs that you monitor for or during anesthesia. So you really need to be very watchful and ready to take action if something should happen and they should stop breathing. Okay, so today I'm going to discuss a respiratory monitor. We use a capnograph here at our hospital. And what that is it is a monitor that is connected, the rebreathing system tube with the fresh oxygen and anesthetic gas is connected to the monitor on that end, and then the E-tube is connected on this end. And what it does is it reads the amount of CO2 during the expired and inspired movement of the animal. It comes up on the monitor here, EtCO2. A reading between 35 and 45 is millimeters of mercury is considered a normal level. However, with anesthesia patients, it would be appropriate if it went up to 55. So the higher the EtCO2 rate is, that means hypoventilation. So you would maybe need to give a couple breaths, decrease isoflurane, something like that. If the EtCO2 level is low, that means they're hyperventilating, so you may want to turn up the anesthesia, the anesthetic, to make sure that they are at a good plane of anesthesia and that it is safe. But that is how you monitor respiratory function in an anesthetized animal. Okay, so today I'm going to discuss and demonstrate how to perform CPR. I'm going to use this little stuffed animal here. So if a patient goes into cardiopulmonary arrest, the first thing you want to do is start compressions. So for a small animal, like under 10 pounds, what you would do is you would, ideally the patient should be in lateral recumbency with the feet facing away from you, and you would use a one-handed approach. So you would wrap your hands around the chest, your hand around the chest like this, and you would give compressions just like that. Regardless of the size animal, you would do chest compressions for uninterrupted 2-minute cycles. At the end of the 2 minutes, you would auscultate and listen for a heart rate. During this whole procedure, you would have your patient hooked up to an EKG. You would also, as quickly as you can, get a catheter in the patient and intubate the patient as well. For a larger animal, larger than 10 kilograms, you would do the two-handed method, just like this, down on the center of their chest, and you would go like this. And if it was like a bulldog or really barrel-chested animal, you would get them in dorsal recumbency, and you would do it in the center of their chest, just like that. So you would want to do compressions to equal about 100 to 120 beats per minute. You would compress the chest about 1/3 to 1/2 of the way, or the size of it, and you would allow full recoil between each compression. So to demonstrate the AMBU bag, what you would do first is you would intubate your patient. So I'm just going to demonstrate with this tube here. So you've got your intubated patient. You have your AMBU bag that is hooked up to your oxygen source. So here we go. You would then connect the tube to the ET tube outlet here. So just like this. And you would never stop your compressions throughout this whole procedure. And you would want to give about 10 breaths per minute. And so what you would do is just squeeze the bag. You don't want to squeeze too much because you don't want to overinflate their lungs and possibly damage it. Most AMBU bags do have a little scale here that you can choose the centimeters per milliliter of water. So for example, on the manometer on an anesthesia machine, you would not want to go over 20. So on most AMBU bags, you can actually set that so you don't go over that rate. Okay, so that is how you would perform CPR.